Please welcome to the stage, Katrice Brooks, MD, founder, Quench Clinic.
Hi, everyone. Today, I'm going to start with a quote from our beloved ancestor, the Pulitzer Prize winner, Toni Morrison. As you enter into positions of power and trust, Morrison says, dream a little before you start to think. And I want to start with that quote because it's really about starting, and that's something that we often forget. So I'm Katrice Brooks, MD, and over the next few minutes, I'm going to tell you about my journey to founding Quench, a direct primary membership clinic in Milwaukee, Wisconsin. And make no mistake, founding and starting Quench took a lot of hard work and a lot of thinking went into creating Quench, but it all started with the dream of imagining what would be possible if I was willing to take the risk. So like a lot of you here, the pandemic was really a tipping point for me. Before the words COVID-19 entered into the popular lexicon, I was pretty much a burned out physician. I had been practicing for 8 years in corporate medicine, and by year 4 or 5, I had pretty much had it. I had 2,500 patients, and I saw on average about 25 patients daily. I saw them every 10 to 15 minutes, like many of you here in family medicine, and it was one after the other, day after day. I would go home and I would be fearful. I would wake up with nightmares that I had maybe missed a lab or hadn't gotten back to a patient the way that I needed to. I got a lot of critique from administration about spending too much time with patients and being slow and running behind. And it felt like a fire hose that I couldn't turn off. We use that analogy a lot in medicine. And at first, I felt like I was just treading water, but eventually it started to feel like I was literally drowning. And I got to the point where I just really couldn't imagine doing it day after day, but I was stuck in the system, and it was what I knew. And so I would have the weekend, shore up, and go back to work. In addition to having to see all of these patients, I had the erosion of autonomy, which a lot of us face. And I really saw that in the pandemic, but I had it before. Like most physicians, I was not trusted by my administration to be able to schedule my own patients. My MA had to schedule my patients for me or change my schedule. I couldn't change the times of patients. Obviously, with care management, I was told how to doctor, and even though I was in the room giving the patients my all, pouring into them everything that I had, I was told by administration that those things that I was pouring into them, the counseling, the mental health, was not as important as the numbers. And though, again, I was doing my best, I was made to feel like I was a terrible doctor. And the problem wasn't really with, when I say administration, it wasn't my coworkers, my manager, my MA, my PSR, it was the system. My coworkers were wonderful people. They showed up in the pandemic when there was the great resignation. We're all showing up and no one else is showing up to do the work. We're all dedicated to patients, dedicated providers and nurses and MAs. But the problem wasn't the people, it was the system. And burnout obviously is a big issue, not just on a personal level, it's a big issue with most providers. You know, most people see burnout when I had burnout, around year 4 or 5, most primary care doctors get burned out, and I experienced that. But again, it was really the pandemic that became the tipping point. The pandemic took me out of my comfortable position that I probably would have stayed in for another 5, 10 years, who knows, and it really made me change. In the midst of the pandemic, in terms of loss of autonomy, administration came down and said, well, even though your RVU, which we were, initially in the pandemic, the first month we were not, but you're still RVU, but you have to come and sit here, and you have to be in the office, from 8 until 4, because your contract says you have to do 36 hours, though we weren't making the RVUs to justify it. We had to be there. And that year, the first year of the pandemic, I actually ended up taking a $20,000 loss. I had to pay the company $20,000 back. So while my corporation got kickbacks and pandemic assistance, I had to take a 20% loss off top, as everyone did, to just make the corporation float. And then that year where I'm getting paid the lowest that I've ever gotten paid, 8 years into my career, I'm getting paid lower than when I started, and I have to pay them $20,000. And so that showed me how much this was costing me, literally. And that was literally, for me, the tipping point. That week that money started coming out of my check was actually the week that I put in my 6-month notice. But instead of just accepting it, and I kind of jumped ahead, but instead of just accepting that, I got busy. I started to research and imagine what might be possible if I worked for a system that put physicians and patients first rather than profit that we saw during the pandemic. And I started to dream. So I joined groups and just started to dream. And this happened in the environment of America murdering George Floyd. And I work in Milwaukee, Wisconsin, and driving to work, a suburb of Milwaukee, driving to work, I had to pass by Confederate flags in this northern city. And so normally I would counsel my patients, if you're unhappy, if something's not working, if your blood pressure's high, if you have diabetes, change something, right? Something that you're doing may be the cause of it, so something that you can do may change it. So I had to take my own advice. I was working, I felt invisible, I felt underappreciated, and I knew that I was not serving my true purpose. And so I decided to do the opposite. Rather than feeling powerless, I realized that in order for me to be in a system that was different, in a system that put doctors and patients first in Wisconsin, I would have to build that system. I would have to build that product. And I had this realization while my mother was in hospice. She had an anoxic brain injury, and she was in hospice for a month. And so that month actually took off the full month to be with her, which was a privilege, but that month helped me realize what was really important to me. And I realized for me, family and relationships are what's important. At the end of our lives, throughout our lives, being there for people is what's really important. Also for my patients, the relationship with my patients, but I realized I was very relationship focused. That's what serves me and builds me. And so I grew up on the west side of Chicago. I am a daughter of the Great Migration, and my mother, she actually struggled with a drug cocaine addiction throughout my childhood. And so I was raised by my father about after the age of 7. But before then, and even with my father, I grew up in poverty. So I lived in a health and a food desert. And that's part of why I went into medicine. I really wanted to see the unseen. My mother, as someone who was on drugs, I saw as she moved throughout the world, many people didn't see her, acknowledge her, and I didn't like the way she was treated, and therefore how I was also treated. I was, an invisible member of society, and I wanted to make sure that I did see my patients as well. That was something that was really important to me, to have radical acceptance for my patients and spend time with them and be with them. And I tried to do that in corporate medicine, but again, the corporateness of it did not like me to run behind. That's not how the model works. It's a volume-based model, not value-based per se. And so that being away from medicine for that month, when I came back, it made me realize that my job was actually taking me away from what was important. And so when I came back, I realized that I had to make a change to my relationship with medicine. Instead of feeling like a victim to medicine or to the corporation or to my life, I needed to change to a relationship where I actually felt empowered and in control. And by doing this, by figuring it out and figuring out not only why I was unhappy, but what would make me happy, what would serve me, I realized on the journey to entrepreneurship that as a physician, I had already developed the skill set that would make me a really good entrepreneur. That's not to say that I am a good entrepreneur. I'm on the path to becoming one, but the skill set as a physician already helped me to learn how to develop those skills. So as a physician, we are really, really good at learning a lot of information and implementing it fairly quickly. We're like super learners. So I don't know anything about entrepreneurship, but I know how to learn. So I learned to read the books and join the Facebook groups and listen to Mariel's podcast and to know the people who knew the stuff so that I could learn it. Also, as physicians, we are really good at working hard. Residency is not a cakewalk. And so to be able to get through that successfully, we already have the priming to be a hard worker and a great entrepreneur. Something that I've learned about myself throughout this journey that probably made being an employed physician a little more difficult was that I'm likely neurodivergent or ADHD, but that has actually become a superpower in entrepreneurship. I'm able to juggle many tasks easily and to hyper focus on things and to pivot. And so, most importantly, what I learned during this time was actually what I wanted to build and the kind of thing that I really wanted to create. So I spent a lot of this time thinking, and I imagined what I would like to do and what I wanted to make in the world and what I wanted to give to my patients. And so what I did is I created Quench Clinic. So Quench Clinic is Quench Clinic Fitness and Spa, and is a space where I spend real time with patients. I'm able to connect with them, to answer their questions, to really assess their health needs. I'm able to give them access to ancillary services that they wouldn't otherwise have. I have a special passion for aesthetic medicine. I got trained in lifestyle medicine when I was trying to figure out how to create happiness. So aesthetic medicine, lifestyle medicine, we have a virtual gym, we'll have a in-person gym soon, mental health access, and things they wouldn't otherwise be able to get. And it has been hard, and there are some days that, I think, what did I do? Why did I blow up my life for this? But honestly, I'm much, much happier and much more fulfilled. And so a year later, here we are, and my life is totally different than it was a year ago. A year ago, I was attending virtual DPC summits and actually in-person DPC alliances, but I was employed and unhappy and waking up with nightmares. And now I go to bed resting easy, knowing that I'm providing a valuable service for my patients and that I'm providing true value and connection with them, that I'm serving myself, that I'm creating something that's sustainable for myself and for my patients so that they can get care that they could not get when I was employed. And what I have found for me is that entrepreneurship has been the cure for burnout. Now, if this has struck a chord for you at all, if you are, a year out or 10 years into it, I want to let you know that it is possible for you to imagine and to have a different life. It is possible. And it is possible to take off those golden handcuffs no matter how comfortable they are. Here I am, my clinic is only 8 months old, but it is already paying for itself. It's not paying for me, but it's paying for itself. And I'm so happy. I see 6 patients a day max. I'm not working every day. Afterwards, I'm invigorated rather than feeling depressed and tired and I can't give to my family. I feel happy and energized and I want to do more. And I'm full of ideas and I can see these ideas to implementation. And it feels so good to actually have an effect and to feel that I have an effect on my life and on my patient's life rather than the 5 minutes that I could spend with them before. So the next thing is to take the next smallest actionable step. That's it, right? Honestly, just by being here, just by listening to this is it. That's it, little by little, smallest step by smallest step. Part of it is getting the information, but it's also where the action meets the road, where the magic happens. So get in community, find mentors, do trial and error, try things, see how it works. It might not work, that's part of entrepreneurship, but you can try again. And also remember what Elder Toni Morrison said, dream a little before you start to think. So take the first step. You don't know what you're missing because you haven't built it yet, but you can. Thank you. My email, thank you so much. My email is at hello@katricebrooksmd.com. It's just my name and MD. Please reach out with any questions. Thank you.